Okay. Assalamu alaikum, everyone, and thanks for joining this month's Google Hangout. It is part of Muslim Wellness Foundation's latest initiative, which is called the Healers Collective. And the reason why we started the Healers Collective is to give Muslim mental health professionals an opportunity in an online platform to begin to connect, to collaborate, to consult with one another regarding issues related to clinical practice, but also professional identity as Muslims, and to focus on different current events that are also happening in the community for us to begin to dissect, our role as professionals in facilitating healing, being able to facilitate access to services, as well as talking about some other issues related to how we conduct ourselves in the community. So this month, I'm pleased to have three dynamic panelists who agreed to graciously offer their time. And the topic for this month's Hangout is responding to sexual violence in the Muslim community, the role of Muslim mental health professionals. So I have to say at the outset that there is sort of the trigger warning, and that is, we recognize that this is a very difficult topic to discuss, and that we recognize that it's very important for us to take care of ourselves as we do this healing work, but also recognize that there is the potential for vicarious trauma, for burnout, for compassion fatigue, that these are very delicate and sensitive issues. And, we just encourage everyone to take care of yourself, to get the proper support so that you can continue to be an asset to the community. So with that, I'm going to introduce our panelists. Let me just back up just for 1 second. And for those who may not be familiar with Muslim Wellness Foundation, the mission is to reduce stigma associated with mental illness, addiction, and trauma in the American Muslim community through dialogue, education, and training. And as I stated, the Healers Collective is Muslim Wellness Foundation's latest initiative, providing opportunities to network, to share research, discuss clinical insights, but also explore the impact of spirituality, race, and gender on professional identity and practice. So if you have been able to register for the Healers Collective, I would encourage you to do that. We plan to, inshallah, hold monthly gatherings so that we can discuss a range of issues. And this month for March being responding to sexual violence in the Muslim community, the role of mental health professionals. And again, that disclaimer that the trigger warning is there. These are sensitive issues. We recognize that as healers, we also have personal experiences which impact our ability to provide the kind of care that we provide. So definitely get the support that you need, either through clinical supervision, peer support, family, friends. Again, self-care is very important. So our panelists today is Nadiah Mohajir. She has a master's in public health and is the co-founder and executive director of Heart, Women, and Girls. Dr. Sarah Syed, who's a consultant at the Khalil Center. She is a clinical psychologist. And finally, Sarah Rashid, who's an educator, a writer, an artist, and survivor. And I'm going to allow them to kind of explain further who they are, what they do, and introduce kind of their perspectives on responding to sexual violence. So with that, Nadiah, if you can, you're up first, just to provide the viewers a context for some of the emerging themes and some of the current events that have really brought this issue to the fore.
Assalamu alaikum, everyone. Thank you so much for taking this time out today to join us. My name is Nadiah Mohajir, and as Camila mentioned, I'm co-founder and executive director of Heart Women and Girls. I wanted to, first of all, thank Camila and Muslim Wellness Foundation for inviting me to speak today on this important topic. And I'm just going to be sharing a little bit about Heart's work and our most recent involvement in the sexual abuse case here in Chicago. So just setting up my screen share. Great. I hope that works for everyone. Real quick about our work. Heart Women and Girls was founded to fill a void in the community. As I was working on reproductive and sexual health issues, people began sharing with me many of their stories. And soon I learned a huge, diverse group of women and girls sharing their stories with me, and it ranged from, women and girls who were struggling to identify common medical problems, to young women struggling with intimacy issues, and all too often we heard of stories about sexual violence. And despite the fact that these problems exist across across all cultures, socioeconomic statuses, and education, there was one common theme with all of these stories, and that was that these women and girls, particularly those in faith-based communities, did not feel that they had the safe space to learn and seek information on their sexual health experiences without being blamed and shamed. So this is actually the void that Heart seeks to fill. So as such, Heart Women and Girls seeks to promote the reproductive and sexual health of faith-based communities through culturally sensitive programming. And one of the ways that we do that is to provide a safe space, both virtually and in person, for women and girls to come together to learn about their bodies, share their experiences and challenges, and ultimately become a resource for their communities. So our approach is simple. It's to present sexual health information and resources in a way that is accurate, comprehensive, but free of blame and shame, so that those who are struggling with a sexual health issue actually feel comfortable seeking information and resources. So as I mentioned, all too often in our workshops, we heard stories of sexual violence and the silence that survivors feel forced to live in, and the lack of culturally sensitive resources out there. So our most recent work was on a sexual abuse case against a prominent Imam in Chicago. Late last year, a young woman came forward with allegations of sexual violence against a prominent Imam in the community. And soon we learned that she was not the only victim, and that there were many more victims, and that the abuse actually spanned decades. So just last month, 5 of those survivors, 4 Jane Does and 1 John Doe, filed a civil lawsuit, and the Imam was also criminally charged. So Heart played a central role in supporting the survivors by connecting them to the social and legal resources that they needed, as well as to raise awareness about sexual violence in the community. Since, community pressure and cultural beliefs were one of the biggest barriers facing survivors with respect to coming forward, we really wanted to work on, raising awareness in the community and what people as bystanders and, community members could do to support these survivors. So one of the central questions in this process was, what does a victim-centric approach look like? We live in a world that is inherently, it doesn't support survivors' healing. The legal process is exhausting and often unsuccessful. There are numerous obstacles and pressures that face survivors that prevent them from coming forward. And so our entire focus in this effort was to support survivors and empower them with whatever they needed, and in terms of information and resources, in order for them to move forward with their healing. So there were actually a number of lessons that we learned in this process, and I'm going to share a few of them with you. I hope that this helps you provide a little bit more insight as you work with your clients, in particular around issues of sexual abuse and sexual violence. So the first lesson we learned was that there is a greater likelihood of underreporting in Muslim community compared to the general public. We learned that there is a long overdue need for safe space and open conversation on sexual abuse. We learned about what victim blaming looks like in the Muslim community, and it's laced with a lot of religious language. And we learned about the importance of self-care for professionals. So our first lesson was about the likelihood of underreporting. So according to the Rape, Abuse, and Incest National Network, 1 in 6 women are victims of sexual assault, and more than 68% of sexual assault is not reported to the authorities. Even though there's actually very little data specific to the Muslim community, anecdotal evidence actually suggests that rates of sexual violence are similar in the Muslim community, and the likelihood of underreporting is even higher in Muslim communities due to some very specific cultural challenges. In our specific case alone, we had about nearly an 80% underreporting rate. So 80% of the survivors that we're working with actually did not want to move forward with the legal process, let alone come forward to their families, the perpetrator, the institution. So that raises an important question that I want you all to think about is, knowing the high rates of underreporting, what does that mean for holding our perpetrators accountable, and what does that mean in terms of creating a system of community accountability? So we all know that there are barriers to reporting sexual violence, and those barriers are pretty much cross-cultural. It's inherently difficult to be a survivor, and the experience is such a great violation of one's emotional and physical safety. But that being said, there are a few unique challenges that made it further challenging for survivors to come forward in the Muslim community. And so these are stigma and shame. There's much shame and stigma associated with sexual violence in the Muslim community. The importance that is placed on modesty and privacy and purity, it actually sometimes is confused and considered immodest to talk about, sexual violence openly. And oftentimes many survivors feel as if, they could have prevented such a crime from happening by behaving a certain way or dressing a certain way. There's a lot of self-doubt. A lot of survivors question themselves and say, did this even happen? This is especially greater when we're talking about a perpetrator that's a religious leader with high rapport in the community. There's a general shock and disbelief that survivors feel, as if they imagined such an experience, and as a almost disbelief and shock that a person of such religious standing would actually commit a crime of this nature. There's also a guilt of exposing the institution or imam that is known to do so much good for the community. There's also a fear that no one would believe them, especially when the perpetrator had an important role in the greater community. And finally, there's a fear of social and community consequences. So in a close-knit community like this one, the fear of being ostracized or never getting married is actually a very real fear, or breaking up a family and creating that kind of rift in the community. So another lesson that we learned was that the need for open conversation about sexual abuse is long overdue. And this case for me really highlighted that for me, and the importance of the work that Heart does, because we really need to start having these conversations at every level. So in the home, parents with children, at the mosque, at community institutions. And we need to do it in a way that is free of blame and shame, so that those who need to seek help can do so without fearing of being shamed or blamed. And additionally, it's really crucial to talk about sexual abuse openly, because there's actually a lot of misinformation out there. So, for example, many don't have the tools or language to talk about sexual abuse. And this is especially true with young children. If parents don't have open conversations, especially with those that are free of shame on these topics, children may never have the tools or the language to describe when they're being harmed, or even identify when they're being harmed. Also, from the community, from just having conversations in the community, we learned that most people don't understand sexual violence. Many think that it's limited to rape and not necessarily a whole range of abuses. And most are often preoccupied with whether or not an actual rape occurred. And if it didn't, then the abuse and assault is generally minimized or ignored. And finally, there's a confusion of values. So I mentioned before, the emphasis on modesty and privacy is often conflated and confused with shame, and that encourages a silence around most issues pertaining to sexual health, especially sexual violence. So I wanted to talk a little bit about victim blaming. Victim blaming, again, is cross-cultural. We live in a culture that's rampant with victim blaming and shaming survivors and passing the blame back onto them for any assault that they may experience. A lot of the work that we did in supporting the survivors focused on the following question. How can professionals act as a resource in the community by having conversations with the general community, raising awareness, eliminating victim blaming when they notice it, but also by actively working to create safe spaces for survivors and their families. So we all know that victim blaming is huge. Has a huge impact on victims. It further traumatizes and devastates survivors. It obstructs the healing process, and it also pressures survivors into not coming forward or seeking justice. But victim blaming in the Muslim community has, in particular, a conservative religious community takes on a special religious shaming. So, for example, sexual violence is often talked about in the context of zina, which is fornication or adultery, lowering one's gaze, and separation of gender. So comparing sexual violence to fornication and adultery, which is an act of consensual sex between two adults, is actually offensive to the survivor's experience, and bringing up the need for guidelines around lowering one's gaze and modest dressing and separation from gender is known not to be preventative in nature. And we know this because of how rampant sexual violence is in Muslim communities around the world, particularly in the Muslim world where women are mostly dressed modestly and gender is generally separated. So additionally, the community's response to allegations of sexual violence is, it's an uncomfortable topic to talk about to begin with, but it's generally, the community, generally the rights of the perpetrator is, again, we can see this cross-culturally in some of the cases across America. Generally, the rights of the perpetrator are referred to, but the victim's rights and suffering is not really acknowledged. A general response in the Muslim community when something like this is exposed is to not spread gossip and not backbite, and to give the perpetrator 70 excuses. Not only is this hugely disempowering to survivors, but it also enables a culture of silence, and ultimately it protects perpetrators from being accountable. A lot of scholars will argue that it's not spreading gossip or backbiting or the 70 excuses doesn't really apply to a crime that is actually harming other individuals, including children. So finally, I just wanted to make a note on self-care for professionals. This work is so hard, and it is so hard for us to take a break. But that being said, a break is very necessary in order to keep going and sustain yourself and sustain the work. It's really easy to burn out and very easy to get disheartened when we're dealing with a sensitive topic like this in the community. And it's really important to take the time that we need and have a consistent self-care plan in place. So the questions that I leave you guys, maybe perhaps for the discussion after everyone is done presenting, is the following. So what can we do to eliminate shame and stigma associated with sexual violence? What can we do to decrease underreporting and empower more people to report? And what can we do to eliminate myths and misinformation? So I just want to leave you with my contact information, and at this time I will ask Camila to take over, and I will be available for questions afterwards.
Okay. Thank you so much, Nadiah, for giving that overview. And I was actually jotting down notes because I think it's important when you say how to take a victim-centric approach. So that meaning kind of the concerns and the pain and, you know, the trauma that the victims have experienced are what becomes primary. And I think, unfortunately, as you said, some of the guilt and shame around exposing a religious leader, especially one who is kind of revered and renowned in the community, you know, takes a lot of courage. And that courage and the bravery gets lost often in debating, you know, whether or not someone should have come forward or whether or not these allegations are actually true. The actual pain, you know, is something that really kind of becomes minimized. So I think it's important for professionals, particularly, to make sure that they also are taking a victim-centric approach. If we are also members of, you know, we have to always navigate these dual relationships. So if someone does come forward and we're a member of that community, we have to be aware and kind of do some self-reflection about how we're responding to those allegations, while at the same time having a responsibility, you know, to support that person during that time. So I'm going to, our next panelist is Dr. Sarah Syed, who's a consultant with the Khalil Center, and she'll be able to explain a bit more about the process of reporting, as well as some useful recommendations for treatment with sexual abuse survivors. So you're up.
Assalamu alaikum, everybody. Thank you so much, Camila, for the introduction. And again, thank you, everyone who is here tonight participating with us. You know, like Nadiah said, this is a really important topic, and right now, certainly on the forefront for a lot of us. But it's not something that just came out of nowhere. This has been a problem in our community for a long time, and it's been severely under-addressed. And so I'm glad that we had this opportunity, and Muslim Wellness Foundation was able to put this together to help us do better with that, and inshallah, from here on, be better at addressing this. So 1 second while I put up my presentation. So we're talking about sexual abuse in Muslim communities and how to treat it. And like Camila said, I'm at the Khalil Center, which is a Muslim counseling center here in the Chicago area. It's in Glen Ellen, Illinois. All of our staff are licensed mental health clinicians, therapists, counselors, and like we said, I'm a clinical psychologist. So I'm going to start out with some information that many of you may already know, basically like some definitions. What is sexual abuse? Abuse is defined as criminal sexual activity involving a victim below the age of sexual consent or incapable of sexual consent. The difference between abuse and assault is that when we talk about sexual assault, we're talking about essentially the same idea, criminal sexual activity. It would be unwelcome, unwanted, but it's towards an adult who is capable of consent. Still, not that they gave consent, but that they are capable. Hopefully that's clear to everyone. And just for, sorry, 1 second, I'm hearing that, or I'm learning that the screen is not available to everybody. Sorry guys, just 1 quick second. Let me make sure everyone can see the screen. So hopefully everybody can see it, and I believe Muslim Wellness Foundation is going to have this available. It will be published online, so anyone who is having trouble seeing it, I apologize, but inshallah it will be online. So assault versus harassment. So the National Center of Victims of Crime says when someone touches any part of another person's body in any sexual way, even through clothes, without that person's consent, that is considered assault. Harassment is unwelcome advances, requests for favors, and other verbal or physical conduct of a sexual nature. This can affect an individual an individual's employment, unreasonably interfere with an individual's work performance, or create an intimidating, hostile, or offensive environment. So harassment essentially is verbal, emotional, or psychological, versus assault, which is physical. Unwelcome physical contact is not harassment, it is assault. And a little bit about mandated reporters. I tried to be thorough in what I have here on the presentation. I don't want to go into too much detail with this. Again, all of this will be available to you. And again, we are in the state of Illinois. So for Illinois, a child is anyone under the age of 18, and we are mandated reporters not only of children, but also of an elderly person or a disabled person who is unable to report their own abuse if they needed to. So mandated reporters not only would cover abuse for children, but also elderly or disabled persons. The difference would be a domestic violence victim. You're not mandated to report something like that. So hopefully we'd be able to talk to them and help them decide to make a report themselves. But if you're a mandated reporter, there are consequences of failing to report. It is a crime. You can face, employment termination. You can face legal fines and penalties, even jail time. The state of Illinois does offer immunity. So Illinois law protects the identity of all mandated reporters and gives them immunity from any liabilities that come from a good faith report. However, any mandated reporter who fails to report an instance of child abuse or neglect commits a crime and may be prosecuted. A lot of people tell me that they are concerned with making a report because they're worried what if they were wrong. They don't want to be, committing any kind of crime against the family or against anything. So there is, at least in the state of Illinois, there is immunity if you made a good faith report. And the biggest thing to remember is that you are not the investigator. A mandated reporter's job is to report the crime. The investigator will determine if abuse is occurring. A lot of people really seem to struggle with this, and I've had teachers, board members of masjids, board members of different organizations tell me that they didn't want to make a report. They had a strong feeling, they had a gut feeling, but they didn't want to make a report because they weren't positive. They didn't have physical proof, for example. So this is just a reminder that you are not an investigator. It's not your job to have the proof. If you have a gut feeling, if you've seen something that concerns you, make the report. If nothing else, I have had cases where it might have been questionable what was going on, and having somebody ask, like having a CPS or DCFS come, that's scary, absolutely, but sometimes that can be enough to stop something happening, even if it wasn't going to be a full-blown child abuse investigation. But again, you're not the investigator, your job is to make the report. And an abused child, by definition, includes, but of course is not limited to, basically means a child whose parent or immediate family member or any person responsible for their welfare, basically like someone in their home, such as the child's parents, paramour, like if they're dating somebody, if they do something that causes physical harm or injury to the child, if they create a risk of physical injury to the child by other than accidental mean, if they create a risk of physical injury which could cause in death, disfigurement, and things like that, if they commit or allow to be committed any sexual offense against the child. So if one parent or one adult or somebody in that home is committing the assault and the other people in that home know about it and they see it, they would also be considered part of the abuse. Committing or allowing these acts to be committed and any kind of excessive corporal punishment, that's what's considered capable of being reported. This includes neglect. A neglected child is any child who is not receiving the proper necessary nourishment or medically indicated treatment, including food or care, or otherwise is not receiving proper or necessary support or medical care recognized under the state law. Anyone in the state of Illinois is welcome to go to this website. This is a training that you and members of your organization can take. The purpose of this course is to help all mandated reporters understand their role in protecting children. So who is a mandated reporter? Hopefully most of you know if you are employed in a way that requires you to be a mandated reporter. But here's a list. There's quite a few on here. And if you go to the website listed earlier, you can find many, many, many others. I just put the ones that I thought would be applicable to us right now on this discussion. So certainly physical and mental health providers, even hospital administrators, and all the way at the bottom you'll see clergy, of course, is on here. Daycare, nursery school personnel, law enforcement, things like that. So who else? School personnel, including administrators and both certified and non-certified school employees and volunteers, members of a school board or the governing body of a private school or the governing body of a private religious institution or assembly or youth director or any employed member who interacts with children. And the bottom here it says, any member of the clergy having reasonable cause to believe that a child known to that member of the clergy in his or her professional capacity may be an abused child shall immediately report or cause a report to be made to the department. So as Nadiah mentioned earlier, treatment is very, very important for survivors of abuse. And of course, in our community, mental health treatment is not always viewed positively. We don't always go to that option. A lot of families tend to prefer private mediation, which we know can sometimes make the problem even worse. Sometimes in our community there's a fear of counseling, mental health treatment in general, even from Muslim counselors. As a Muslim therapist myself, I've had people very concerned with who I might be sharing their private information with and things like that. And you know, a lack of family support. It is extremely important to support a victim, to support somebody who is a survivor of a crime like this. Even, you know, the role of the extended family can play a role in helping support. And a lot of our communities have don't always have just a nuclear family. Sometimes there are joint families or extended family members who are very important and would play a big role in helping the survivor get the proper treatment. But when, inshallah, treatment is sought, you know, we try to be there for them. Some people will say that, you know, like we kind of mentioned earlier, that Islam tells you to hide this or tells you not to get help, and that's really not true. And most of my research and what I've encountered, Islam encourages reporting. Muslims are encouraged to seek out justice and change their situation. There's a hadith that some of you may be familiar with, that if you see something wrong, you should correct it with your hand. If you're unable to, then speak out against it. If you can't do that, then at least feel that it is wrong in your heart. It doesn't say anything about protecting a criminal, protecting somebody who is going to continue abusing. If someone is brought to us, you know, as a clinician, one of the first things I would do when I have heard what's going on is assess for the trauma. These are some of the questions that I'm going to be asking the family member, or whether it's a child or an adult, but these are the things I'm going to be trying to get an idea of. The relationship of the survivor to the abuser. So what I'm trying to figure out is there going to be ongoing abuse potential? Is this a relative? Is this somebody who has access to the child? Is this somebody, you know, was this a one-time thing? Is this something that's going on at school, at home, at the masjid, at a, you know, community level, the neighborhood? What's the relationship? And how stable is the family? We know that there are much more positive outcomes in mental health treatment when there's a stable family and good family support. So is this a family that needs help? Maybe we can help, you know, provide other resources. Maybe we can connect them with groups that can help them be more stable, you know, give more resources and things like that. Are there alternative support systems available? So if the family, maybe the nuclear family is supporting the victim, but they're not getting the support they need from their extended family, is the community willing to step in? You know, what are the risk factors? What else is going on in the survivor's life? And if it is a child, should they remain with the family? And sometimes that can be very painful and very difficult to gauge, but if the child's safety is in danger from staying with the family, then that's a decision that, as clinicians, as professionals, that sometimes we need to help make and support the survivor as best as possible to keep them safe. Do the courts have a role in the case? So is this, for example, if it's a child, the answer is always going to be yes. If it's an adult survivor, maybe not. It depends on what's going on with them, whether or not they're choosing to pursue legal actions. But in the case of a child, that answer is always going to be yes. And again, in the case of a child, is there a question of visitation? You would be surprised, but sometimes we do have to deal with that to figure out if somebody who is abusing a child is going to be given visitation rights, and how can we support the family, how can we support the survivor, how can we make sure, again, like I said, that the survivor is able to be kept safe. When treating survivors of abuse, these are some of the things that I have come up with just based on the work I've done and different resources that I've found, through school, through peers, through my professional experiences. Of course, the consequences of sexual abuse vary widely in everybody, from severity, duration, form. So all treatment cannot be the exact same. Was this a one-time thing? Was this an ongoing thing? And what was the severity of it? Where was it happening? Who was the offender? All of these things can make a difference in what the treatment may look like. Treatment is, of course, the process of helping the child learn to distinguish between healthy and destructive coping skills. Our job as clinicians will be to help them find healthy coping skills so they can deal and process with what happened. And ideally, effective treatment will lessen the severity of intense symptoms and guard against delayed onset of emotional disorders. Honestly, there's no way to say why one survivor responds a certain way and someone else responds a different way. We just don't know why that happens. There's a lot of literature about the different emotional disorders, the different symptoms that survivors experience, but there's nothing that can explain why it looks different among people. So when we as clinicians are treating survivors, we need to be aware that everyone presents differently and everyone responds differently. And so be aware that there is no one kind of cookie-cutter treatment that's going to work for everybody. Everyone is individually different. Their abuse is going to have been different. And so we need to make sure that we are responsive to that and able to work with what they have going on in their life. These are some of the goals of treatment when you're working with an abuse survivor. You want to be sure you can provide them with a safe release of feelings. Make sure they're not feeling judged. Again, as Nadiah mentioned earlier, in our community, it is very hard sometimes to talk about anything to do with sexuality, to talk about anything to do with abuse, and particularly if it was someone that is considered respected or considered important to the community. The survivor, child or adult, may have a very hard time talking about it, even in a therapist office. So helping them feel safe, helping them feel respected, helping them feel that they are not being judged would be a major goal of treatment. Ideally, inshallah, overcoming negative and potentially self-destructive behavior. We know that a lot of survivors who do not get treatment and who aren't able to get help after surviving abuse can have self-destructive behavior. We know that a lot of people struggle with things like that. So being able to help them overcome that would, of course, be a goal for treatment. Helping children understand what part of their thinking may be affected by the abuse and helping them correct distortions. Sometimes, honestly, this is also true for adults. I have had people who really believe that they did something to cause the abuse that happened to them, that if they had been different, if they had been better, if they had been good, that it wouldn't have happened. Or that now that the abuse has happened, now they are somehow tainted, they are somehow impure, unclean, not worthy. And these are distortions. These are just not true. But just saying it, of course, we know isn't enough. We have to help them understand it and process what that means for them. Helping them overcome self-blame and self-hatred if that's something that they're struggling with. Again, don't assume that every survivor sitting in your office is going to have self-blame or self-hatred. Everyone's different. But if that is something they struggle with, then we have to help them overcome that. Helping them build a sense of trust in themselves and in a positive future, that this does not have to be the end of the world. This is not a good thing, of course, but this is not the end. This is something very bad that happened. This is something that we wish hadn't happened. But now we rebuild. Now we move on, and helping them learn to trust in themselves again, which also means helping them understand what happened. We might not ever be able to answer why they were the person abused or why this person abuses anybody, but help them learn how to trust in themselves, help them learn how to keep themselves safe in the future. Enabling a survivor to gain a sense of perspective about the abuse and to gain the emotional distance necessary to keep the trauma from reoccurring. We know that, for example, children who were survivors of physical violence or who grew up in a home with violence are more likely to end up in relationships that still have that. And part of a treatment goal of working with the survivor would be to help them identify the emotional distance they need to keep from people who would bring that back in their life. And certainly with their abuser, if it's somehow this is somebody who still has access to them, or this is somehow somebody who can still have a role in their life, how do we keep them? And in that case, it might even be physical distance, not just emotional distance, to keep the trauma from reoccurring. And finally, and this is something that even as clinicians sometimes we can struggle with, but supporting the child as he comes to terms with his own sexuality. That includes the good feelings surrounding sexual behaviors and the ability to discriminate healthy sexuality from abuse. It's very shaming and almost damning when someone feels that they either caused the abuse or they deserve the abuse because some part of the experience was enjoyable to them, even though they never consented, or in the case of child abuse, they were not even, able to consent. And that can be extremely confusing and extremely painful to figure out where the boundaries are of that. So to do some psychoeducation in terms of what is normal sexuality, what is healthy sexuality, normal is not the right word, what is healthy sexuality, and how do you understand that your body is made a certain way. Certain feelings are perfectly, healthy to have, but the way that you were forced to experience them is what made it abuse. The way that you were taken advantage of, your vulnerability was taken advantage of, makes this abuse. So supporting them through this. And again, this could be something that we work with the same with the adult survivor. This is not necessarily something that only a child or someone prepubescent or adolescent person would deal with. This is absolutely something that an adult would deal with. Because like Nadiah said earlier, we don't always have good conversations or productive conversations about sexuality, and even adults struggle with understanding that. So inshallah, I hope that was helpful to you all, and I hope that you all, if you have any questions, please make sure that you let us know at the end. And like I believe Camila had said that this will be available on our website. So make sure that you look it over if you have questions, particularly about the mandated reporter part and the training that's available. Jazakallah khair for the opportunity, and I'll turn it over to our next presenter.
Okay, thank you so much, Dr. Syed. I mean, that was a very comprehensive overview, and I particularly like that, you established some of those treatment goals that have come out of some of your work. And I just, as you were speaking, I wanted to also emphasize for our viewers that abusers are not always male. So I think that when we talk about, abuse, and sometimes we even use he as a pronoun, that we have to be very careful, because for those, say perhaps boys who have been abused by women, or girls that have been abused by women, it takes on a different dynamic. So we want to make sure that when we're talking about abuse, and this is, for professionals, that when we're talking about abuse, that we're also open and allowing for children, maybe they have had multiple abusers, and so that, you know, we're not in some way inadvertently shutting down, you know, their disclosure by implying that, you know, abuser is always male, to perhaps a girl child or to a woman. So thank you so much for that, and I'm glad that it'll be captured in once the YouTube video is uploaded, it'll be there for people to kind of review. So our last panelist is Sarah Rashid. She is an educator, a writer, an artist, and she is also a survivor. So she has been gracious enough to share her story and her journey of healing with everyone here, to, again, put a human face to this. This is something that happens quite a bit, but we are often not able to hear directly from people who have gone through their own journeys. So thank you so much, Sarah, for agreeing to speak with our viewers and to share your perspective.
Thank you, Camila. Assalamu alaikum, everyone. My name is Sarah Rashid, and I am on this panel to talk about my personal experience and hopefully share some helpful points as to how the best ways to help survivors of sexual assault. So one of the reasons I'm on this panel is because last year in January I wrote an article that was published in the Islamic Monthly, where I discussed my challenge with overcoming my healing process and overcoming childhood sexual abuse. And fortunately, the reception to that article was very good, and it opened up a lot of conversations and allowed me to speak to individuals, to groups, and at events about the perspective coming from a victim's point of view. And so the first thing I want to talk about is why I chose the approach I did for my article. I'm not going to reiterate what I wrote because you're all welcome to go to Islamic Monthly and read the article. But going back to what Nadiah said about victim-centric approach, that's the kind of the approach that I took with my article, where I really wanted the audience to understand the psychological and emotional damage that abuse causes, even years and decades after the fact, because that's a very difficult thing for people to sit with and to actually empathize with, because it's something that's so internal and specific to a survivor, and it's hard to know what that's like if you haven't been through it. But I wanted to get that point across as much as possible, and I also wanted to. That was also done in a hope of combating the victim blaming, because I think that the more we can understand the pain that a victim goes through, the less likely we are to blame them or decide with the perpetrator when dealing with community accountability. And secondly, the reason my approach to this article was that I emphasized seeking professional help many times throughout the article, and because that was a huge part of what helped me, and also because I wanted to address the stigma that's very much still in Muslim communities, where the idea of getting therapy is very much frowned upon. And I wanted to show how much it helped me, and also how in some ways I had bad experiences with mental health professionals, because that happens sometimes, and so learning from those experiences and trying to show others the reality of what that's like. So I had good and bad experiences. I'll just briefly go over the 15-year span over which it took me a long time to sort of come to terms with my trauma, and I had been going to therapists for a long time before I ever actually directly addressed it. When I was 13, I went to my guidance counselor. So the abuse happened when I was 8. I spoke about it for the first time when I was 13. I went to my middle school guidance counselor, who handled it terribly, honestly, and in fact re-traumatized me by minimizing what happened to me. And I think Nadiah and Dr. Syed had mentioned similar, they had mentioned that in their presentations, how there's this tendency to minimize abuse, and that really, really deeply affected me. So that experience shut me down and kept me from ever wanting to speak about it again. Even as I went to therapy towards the end of high school to deal with depression that I had. I never spoke about the abuse, and so, you know, I was diagnosed with depression, and I was trying to deal with it the best I could, but I never felt safe enough to acknowledge the impact that the abuse had on the development of my depression. And so it wasn't until I was in my late 20s that I actually started to realize the effect that it was having on me. In large part, as I write in my article, in large part that was due to a good friend of mine coming forward. That gave me a lot of courage to come forward, so I credit her a lot for that. And you know, so I heard that it's pretty common for people, for survivors in their mid to late 20s and early 30s to come forward. I wonder if sometimes if that's just a common time when you're reaching a certain point in your life where you realize how it's really hard to get past if you have not processed something like that from, you know, even decades earlier. And so, you know, I reached the point in my life where I realized that, you know, I was very much stuck, and I was not, you know, growing and evolving the way that I thought I should be. And so I decided to look at, okay, maybe my abuse had something to do with that. And so that's when I started seeking help directly to you know, dealing with the, you know, sexual abuse directly. So the first thing I did was I sought out a counselor, a therapist, and I did not, so I just want to share some of my experience as to how I dealt with therapists, to hopefully give some of you as professionals some insight into what the other side feels. So the first time that I went to a therapist to specifically deal with this issue, I did not want to talk about exactly what happened. I wanted to say as little as possible. I was not ready to talk about it. And I really appreciate that she respected that. You know, she let me go at my own pace, on my own time, and that was really, really important to me, because I had lost so much faith in turning to people for help because of that guidance counselor when I was 13. I was absolutely mortified that even the nicest therapist would still minimize what happened to me, and I could not deal with that. So I had to really, really take my time and build my trust for a particular therapist before I was able to talk in more detail. Yeah, so, you know, going to her really helped. I also went specifically to a sexual assault counselor, and I did this again because I felt that if there's anybody who knows this issue inside and out, and who is least likely to minimize it for me, who is least likely to make me feel bad or shamed or guilty for it, it's somebody who deals with this issue all the time, a sexual assault counselor. And I actually think that's one of the best decisions that I made. Not to say that, you know, I know all mental health professionals are trained to deal with this issue to varying degrees, but I do think I got something special out of also working with specifically a sexual assault counselor. And she was somebody who I was able to access for free through the county, which is something that I didn't know existed before. Where a lot of counties, they have sexual assault services, and where you can seek free counseling for dealing with your problem. And at first I went and I thought, well, this did not happen to me in the recent past. It happened to me 20 years ago, and I felt strange going. But she made me feel at ease because she understood that even 20 years later, the trauma can be very real and feel very immediate. And so, you know, I'm grateful that she was able to show that kind of compassion towards me. So to me, you know, definitely that helped to rebuild my trust in seeking help and speaking up about it by receiving that kind of compassion and that kind of empathy from these counselors and therapists. And so, yeah, I mean, I went through, you know, I mean, there's more you can see in my article as far as I went through a lot of different therapists. It took me a long time to find one that I really felt comfortable with. And I think that that's a really tough process for anybody. I think I'm a very tenacious person, so like I fought really hard. I kept going, kept trying to find somebody. Even when I felt like giving up, I kept going. But unfortunately, I think it's really hard to do. And so I think it's important to encourage people to find the right person to talk to, even if that's not you, right? So maybe you're not, you know, and that's not to say that you're not a wonderful therapist, but maybe you're not the right person for this person. You don't have the right chemistry or the right style. I needed somebody who was excessively compassionate, you know, and I knew that not everybody is like naturally like that. So I really made sure to find somebody like that. So so that, yeah, I would say, you know, just understanding that perspective, like everybody's different. People respond to different sort of methods of approach and therapy, and so making sure that you sort of gauge the client and making sure you understand what they need is really important. And so that's just an overview of my experience in therapy. And so I also just want to lastly share my experience coming forward to the community, what that looked like, and some of the struggles that I dealt with there. So, you know, I worked with my therapist and my counselor to take it very, very, very slowly as far as how I was going to come forward. And I'm glad that they gave me that chance to go at my own pace and to make my own choices, which I was very grateful for. Unfortunately, the guidance counselor I had when I was 13, she forced me to tell my mother without any kind of support, without any kind of follow-up, right? So that caused a lot of issues between me and my mom because she had no idea how to handle it. So, you know, it was a huge difference going from that to then working with people who respected that I could make my own choices. And you know, being a lot older, I was able to I knew myself well enough that I knew what kind of choices I needed to make this as simple as possible. And so I took it extremely slowly. It took me over a year and a half before I was able to come forward, from the time that I first spoke to a therapist to the time that I actually came forward. And so, you know, what I worked on during that year and a half was actually, so self-loathing. Dr. Syed mentioned that self-loathing is a very common, you know, symptom for people going through this. That was probably my biggest issue. And so I knew that I couldn't deal with coming forward and dealing with a potential backlash or community shaming if I still had this self-loathing inside me. So I really focused on trying to get rid of that, and it's a very slow process. I mean, I had it all my whole life, and so it took a lot of work. It took, you know, it was frustrating for the therapist too, I'm sure, you know, because I mean, it just was so embedded in me, and I fought so hard against overcoming that it really took a lot of patience on their part, and so, you know, it was really overcoming that and learning how to overcome my self-blame, because, you know, likewise I also blamed myself, and I knew that I could not come forward if I still believed that I was in any way at fault. And also during that time, in addition to working on all these issues, I really tried to build up my community of support, my support system. So slowly coming forward to my best friend, to another very, very close friend, to, you know, like just people here and there that I knew I could count on. And again, even coming forward to them, I was terrified that they would minimize, that they wouldn't understand, but like having the support of the counselors and the therapists there for each step of the way really helped, and thankfully my friends were very supportive. And so slowly, as I came forward to my mother and my brothers and my father, you know, that just, each time I did that, it helped me gain some confidence. And so by the end of all of that, I felt like I had this solid support system with a therapist and a counselor who understood and I could count on. And so eventually that's what gave me the courage to come forward to my friend whose uncle was the one who had abused me. And, you know, that was extremely difficult. And you know, I didn't know, as far as, there was a part of me that wanted to, you know, say the name of this person, who wanted to publicly shame him. And, you know, and I ended up not giving out his name, and I think I made it's different for every situation. You know, there's no two situations that are the same, but in my case, you know, I really care about my friend and her family, and in a sense, I saw them as victims too, because, you know, they have to deal with this family member who has committed this crime, and it's, you know, they had no idea, and it's really hard for them to hear. And so I wanted, you know, because, I mean, especially because they were so gracious to me and they believed me, they supported me, I wanted to reciprocate and show my sensitivity to their situation by also respecting their privacy and allowing them to deal with the situation within their family. That's not always going to be the best solution, but I do think that in this case, that was. At least I'm happy with having made that choice. And as far as like the community fallout, you know, I guess again, fortunately, I mean, I was able to kind of separate myself from my community. So, I mean, if I had, you know, I was, you know, being in my late 20s, I was able to kind of stay away. Sometimes I wonder if I had been younger in my teenage years, if I would have been able to handle the situation coming forward to my community because I would still be so much a part of it. So yeah, I mean, so I was able to separate myself and not directly deal so much with potentially people not believing me or blaming me somehow or shaming me for coming forward. And I know that that's something that's extremely difficult for people, you know, especially in the Chicago case. So yeah, I mean, I know that community accountability is a huge part of this conversation. But I do think that it's important to really work specifically with your client and figure out what's going to help them heal the best, and what's going to, you know, and help empowering them to make their own choices, essentially. So yeah, that's, I believe, all I have to say for that.
Okay, thank you so much, Sarah. And you know, as I was listening to you speak, you know, I was just really impressed and also humbled by just the level of strength that it takes to not only kind of write your story, but then to share that and to be very honest about, you know, the process, you know, some of the process, and we're getting a very abbreviated version, and you know, even within that, it was just, you know, kind of gave me chills, you know, just to hear again firsthand, knowing how many people do experience this level of sexual violence, but are not able to find their voice to speak. So, you know, I'm saying thank you, and I feel like that's insufficient. That's not enough to kind of really convey my gratitude, because there are people who are professionals who are also survivors. There are people who are survivors and who are listening, you know, and who are viewing this broadcast. And, you know, inshallah, the hope is that by hearing you be able to, you know, share so powerfully and so beautifully about what that process was like, will also give them, you know, hope, as you said, hope that there is a way to recover, and that you can continue to love yourself and to appreciate those things about you, and that the abuse doesn't become kind of the total sum of your identity. So thank you. I don't know if the other panelists have questions for you, or if we can kind of go into discussion at this point, but Nadiah or Dr. Syed, if you want to jump in there, feel free.
Yeah, I actually wanted to comment on something, Sarah, you said. I think that's extremely important, and I feel that not just in our community, but a lot of people, when they see a therapist for the first time, it's not like going to the dentist. It's not like getting, you know, you get your teeth cleaned and go home, and it's okay if you don't have a connection to the dentist. It's not like that. When you're in therapy, you have to feel safe. You have to feel respected. You can't feel judged. So, of course, the very first visit might be, you know, intimidating. You might be nervous. So give it, you know, 1, 2, maybe even 3. But after the second or third visit, if you're still not feeling comfortable, if you don't feel that connection, you need to be honest with yourself and be honest with the therapist. If the therapist's feelings get hurt, they can handle it. They're a therapist. Right now, the feelings that are important are yours. You're here to get help. You're here to get better, and it's not going to happen sitting with someone who just doesn't connect with you. You know, they might be the most talented, most expensive counselor there is. That doesn't mean they're the right one for you. You've got to make sure that you feel safe, and you know, the example you gave was excellent, that, you know, you needed somebody who was extremely compassionate, who was warm with you. That might not be something the next person needs, but that was what you needed. And so, you know, it's frustrating when you make the effort and take that step to go see someone and you don't have the connection. I admit that it's frustrating. But even as a therapist, I can say that we don't want to waste your time and just, you know, collect fees from you and not help you. That doesn't help anybody, you know. We also want to make sure. So let your therapist know. Ask for another referral, you know, and they can find you somebody else. Or maybe it's something that they can change about what they're doing. But either way, if you're not feeling the connection, if you're not feeling safe and respected, you have to speak up. Let them know.
I also think that it's important, just to piggyback off of that, to think about what Sarah said about, you know, being persistent with finding the right therapist. And I think that that process in and of itself can be very disheartening. You know, if it doesn't work out with therapist number 1 or therapist number 2, you know, the thought of going to a third therapist and repeating that whole story and trying to build that relationship with them is kind of exhausting and disheartening to think about. But I think, you know, it's important to keep being persistent, you know, like Sarah, and I really applaud you, Sarah, for being so persistent and having faith in the system, because I do think that, you know, and I think, you know, the dentist example was great, although some dentists also suck, right? And so you do want to go to another dentist if, you know, if they don't have good bedside manner or whatever. So it's very similar to, I mean, but the other thing to think about is also that it's time and money that you're also spending. So that is something to consider. So I really appreciate, Sarah, that you brought up the fact that there's a lot of free counseling out there, you know, where you were. And also I know in Chicago, I was looking in like the YWCA and a lot of the rape crisis centers, they all have free counseling, which I think is a really, really fantastic resource that we should be looking towards.
Yeah, Nadia, that was an excellent point. And I have been back in the Chicago area for about 2 years now. And Nadia, honestly, you probably know much better than I do right now. But if anyone is viewing from Texas, I can tell you in Irving, Texas, it's a city-based program where they have free therapy services to anyone who is a victim of a crime. Whether or not you choose to prosecute, whether or not it was a reported crime. If you live, if you work, or if you worship in the city of Irving, Texas, you qualify. So, and then there are programs like that around the country. So again, yeah, Sarah, definitely thank you for reminding us that sometimes it might take a little bit of research. You know, and if you are able to connect with someone, ask for help, because organizations like HEART, organizations like Muslim Wellness Foundation or Khalil Center, even if we can't do what you need, we can certainly help find somebody who can. So you know, exactly, like if the price is too much, or if it's too far away, if the location, something like that, let someone know and try to have them help you get other resources.
I think those are definitely all great points, because even if someone recognizes the need to see therapy, you know, to find a good counselor, I think it also takes a lot of energy. And if the process of even navigating sort of a behavioral health system or a counseling service system, that can seem like more energy than, you know, someone has in the moment. So I thought it was also, you know, extremely beneficial, Sarah, that you said you worked on kind of building a support system before, you know, making that disclosure, and, you know, knowing who around you could give you the support that you continue to need in order to move forward in your process. And I think one of the questions that I had for Dr. Syed, for all of you really, is around involving the family in therapy, and Nadiah, with what your role in Chicago now is, you know, I think at times, how can I say, it's protecting the victim from kind of like the family sort of shock and disbelief when they do finally disclose. So how do you see yourselves kind of facilitating kind of a family process as well as like an individual healing process? And for you, Sarah, Rashid, how was that for your family once you were able to connect with a therapist who, you know, was willing to give you the excessive compassion? I like that excessive compassion that you needed.
For me, I approach therapy, whether it's with a child or an adult survivor or really anyone, like I said, they have to feel safe. And so I don't want to push anything on them before they're ready. So I really, I talk to them about what kind of support they need. And if they say they need their family, then we talk about how do we get that. And we let them be in charge. I don't like to speak for people because I don't want to say the wrong thing, and I want them to feel empowered to do it. So we may practice. We may, literally practice in the session. Like, okay, what would you say? How would you handle it? But ultimately, I let them take control and be supportive in any way I can, whether it's to facilitate the meeting, sit in on the meeting, provide feedback to the family. And of course, it looks different if it's an adult versus a child. But you're right. You need the support network, whether it's your, blood family or the people around you, your friends, whoever your network is. That's fine. But you're right. The role of supporters is extremely important.
And I fully agree with what Sarah said. I think that it's important to think about letting, like you said, the victim and survivor take charge and take control. And that in and of itself is actually quite challenging for them, given their experience and how they were not in control when they experienced, the experience that they experienced. But that being said, giving them that control and letting them call the shots, that was what our victim-centric approach looked like. Like, who do you want involved in this? What kind of resources do you need? Do you want to press charges? Do you want to file it was, nothing, we did not dictate anything for them. It was all from the victim and, any other support and caregiver, like supporters and caregivers that they, with their guidance, that they wanted to be involved in that decision making. But it was really the survivor leading the conversations.
I think Sarah, your mic isn't on.
All right, can you hear me now? So for me, my counselor, actually I had my mother come in to meet with my counselor, and that was very helpful. So she was open to speaking with my mom. Unfortunately, counseling wasn't really effective. Like, my mom did not really relate to it or respond to it, and so that didn't end up moving forward. But I mean, just the fact that my mom made that attempt was very reassuring to me. The fact that the counselor was willing to see her, and just having met my mom, it gave her a lot more insight into our relationship and what we had to deal with within that. So yeah, I mean, I think definitely including, I didn't include really anybody else. But even when I told my friend and I told her family about when I came forward to them, I even offered my counselor, like I offered that they, if they want to speak to somebody, they should go to my counselor. Just because like it's traumatic just to even hear something like that. And so, just I really tried to make her as much a resource as possible to everybody in my support system, and that helped.
I also just wanted to just real quickly say that part of our role in Chicago with the Chicago case was also to create a bunch of written resources for the community as well as families of survivors. And so we actually created like a 2 or 3 page document on how to support survivors from, for the caregivers, so that, they had some guidelines, especially when this news went public.
Could you share just what those maybe top 3 of those talking points were for, just for families of survivors, and again, making, like you said, a victim-centric approach. So the family may say, oh, how is this going to affect us? What is going to be our reputation in the community? And again, that's shifting the focus away from, the person who should be at the center of, kind of the care and concern.
Yeah, so a lot of it had to do with, talking to people about the making them aware of how their language and the way that they interact, their body language and their words and the positive language actually has a profound effect on a survivor's ability to heal. So just what you say, especially when they come forward to you the first time, but also as you are supporting them through this process as the news goes public, just validating their experience and their feelings, and telling them it's okay to feel this way, and that we're here to make sure that we're going to try to make you safe. It sounds like it's just words, that they're insignificant, but they actually have a really tremendous impact on a survivor. Another thing that we wanted to remind people of was, thinking about the unique forms of victim blaming. I mean, a lot of times, it's so easy to engage in victim blaming, especially when we're talking about how the person was dressed, or why he or she was in the room alone with the abuser. All of those are perhaps to us, they seem innocent questions, but they have a really disempowering effect on the survivor. And so just really important on how you ask your question, especially if you're trying to get more details from a minor about what happened, just understanding how you, like, the way that you phrase that question can have a really profound effect on how they feel and what they want to share with you. So asking more open-ended questions like, do you want to share what happened with me, instead of being like, well, why were you there at 3 a.m, or why, and just asking very, very open, non-judgmental questions can make a very big difference. Ensuring that your loved one has a plan for self-care. So whether that means that they have a professional mental health counselor, or something as simple as exercising and sleeping regularly, and journaling and meditation, whatever it is that person needs for self-care, they should be mindful of that. And then also, one of the things that we talked about was just ensuring that you have self-care as a caregiver, as a parent, as a sister, or friend of the survivor, or brother or father. It's really important to make sure that you have that self-care so you can actually sustain supporting that person over a long term.
I think those are excellent points, because when we think about all of the relationships that can be affected by one act of violence, it does have a larger impact, but we want to make sure we kind of sort of keep the epicenter as the survivor, and think about how this is, and understanding also the symptoms of trauma. So it may look different, so people's like, well, I never knew, she seemed fine. Why, and I think one of the, when you talk about questions and how you phrase things, when people say, well, why are you coming forward now? Why are you talking about this now? And that is going to be different based on the individual. It's going to be, a set of circumstances that will be significant for that individual. But I think when we say that, well, why now? It implies like, well, we were all fine with your silence. So why are you sort of disrupting our world? I mean, that's kind of the implication. So I wondered, Sarah, Rashid, if you could, from your perspective, again, talk about language and the language that was helpful for you, and some of those things that were kind of counterproductive to your healing process.
So yeah, that's a really, really important point that you bring up about language and the way that a seemingly innocent question can have it can be received in a very different way by a victim, especially who has not processed their trauma and is extremely sensitive. I was extremely sensitive to language, which is one of the reasons why I went through so many therapists, actually. I would almost kind of test them initially to see if they would say anything that I could construe as judgmental or not compassionate. And so just to give an example, like the most subtle difference, like asking me, so when I first tell the therapist or counselor that I've been abused, them asking me how did it go on for, versus was this a one-time thing or a repeated thing? It's a very subtle difference in the way those two questions are asked, but the way that I when somebody asked me how long did it go on for, it made me feel as though if I didn't say something like a long time, then they would minimize my experience. Like I was that sensitive. And so if somebody if somebody asked me that, I would just say goodbye to them, and try and find somebody else. But yeah, I mean, but what I did eventually, the sexual assault counselor, the free one that I went to at the county, she didn't phrase it that way, and that helped me to trust her. She understood that, how many times it doesn't really, when somebody's coming forward, that's not really the issue to deal with first. Like, acknowledge the person's trauma, validate their experience, and then, later when they're comfortable, you can deal with details here and there, but you really just, to put that kind of question first really, really terrified me. It kept me silent for a long time. So, that's like, there's so many examples, but that's the first one that comes to mind here.
And, I think because it's so difficult to talk about just sexual health. I mean, Nadiah, you know this firsthand. It's difficult to talk about sexual health, but then, to talk about, how people are then impacted by just the silence around sex in general and sexuality, so that when, I think it was Dr. Syed, you mentioned, helping the child think about if there were certain pleasure, that they started to feel as a result of it. Like, how do you deal with the kind of the cognitive dissonance, and knowing this is not supposed to happen, but physically I'm responding, so it's important for us to really think about, and I think to ask the person, is there something that I'm saying or a question that I'm asking that is hurtful to you? Please let me know. And, to keep that space open, again, so that they feel that they have the control of their level of safety, even within the counseling session. So we have about 5 minutes left, and I wanted to, if you guys quickly could say just a little bit about kind of this idea of community accountability. If it does come forward, if we do have to have a conversation in the masjid and Islamic centers and homes, where do we begin to kind of build that process? I know it's a weighty question in just a few minutes, but I think that issue of accountability, so it doesn't just rest on the individual to kind of advocate for themselves, but we need a process within the community that can also support.
Yeah, I think that's a really good point, and right now, because this is a hot topic issue or hot button topic, I guess, I feel like people are kind of, waking up from that sleepy, pretending this doesn't exist phase. Definitely not, completely across the board, and it's definitely not every single masjid or every community, but I personally have started to, get more invitations to come speak to groups. Before, if it happened, it used to be more like, a group of women or just parents of certain ages, versus now it's, the whole masjid, like, being invited to speak to, the general community of that masjid. So I think in terms of community accountability, we are, and as Muslims, we know that we are responsible for our household, and we're responsible for our neighborhood, and we're responsible for our communities. That's part of being a Muslim, is taking care of each other. So I think first and foremost that we do need to be aware that we have accountability. And does that mean bad things can't happen? No, of course not. We know bad things can happen. We know shaitan is there. We know that we're all susceptible. We're all human. Evil exists in the world. But if we're all, learning about it, talking about it, having an open dialogue, if you don't have somebody in your community who can address this, find somebody who can. And I think that's what a lot of communities are trying to start to do right now. So, like I said, specifically myself, Khalil Center, we've been getting invitations to speak on this topic, and I think at the very least that's definitely a start.
I think for me it's about challenging the attitudes that that exist in our community, and being very reflective on, you know, some of the biases and the attitudes that we as individuals hold, that add to the rape culture, and don't hold perpetrators accountable. I think it's important to remind the community their role as bystanders. You know, especially when it comes to things like domestic violence and sexual violence and intimate partner violence in particular. We have this hesitance of, well, you know, especially when we're talking about intimate partners and you know, a marital issue, we have this tendency to sort of, you know, shy away from it and say, you know, that is something that is between the husband and wife, and I can't get involved. But I think it's really important to think about what is the role of bystanders, because there's a lot of time that passes between the abuse and, you know, seeking refuge in a crisis center. There's a lot of time that is in between that, and there's a lot of people that perhaps may know that something is wrong, or even witness something not being right, and they don't feel like they have the skills or the power to do anything about it. And I think it's just about like the community needs to acknowledge its role as the bystander, and just supporting each other.
I definitely agree with that. And I'll add that for me, what helped me come forward, so a big struggle that I had in deciding whether or not to come forward was feeling, I had this feeling like, am I being selfish? You know, it's going to cause a lot of ruptures in the community. It's going to potentially tear some families apart. And I was really, really concerned about that. But what helped me get through that was framing it as a much larger fight against sexual violence in general, where, you know, my coming forward is contributing to a larger movement where hopefully more people will feel comfortable coming forward. That made me feel less guilty about coming forward, I guess. Though I know I shouldn't feel guilty, but unfortunately that is the reality that we live in, is that, you know, by coming forward, you know, you will be seen as the reason why, you know, a lot of disruption has occurred. But I think I mean, you know, what Nadiah was saying about, you know, acknowledging the community's position as bystanders, definitely really important. And for me, it was important to see myself as a mouthpiece for victims, you know, and to help to break that silence.
Thank you all so much for you know, your time and your expertise and your experience and your passion. I mean, I think this is very difficult work to be engaged in, but it's so necessary. And knowing kind of the high rates of underreporting, as you mentioned, Nadiah, but also that there are men and women as adults, you know, who have memories of this kind of violence and are unable to speak about it or know that it's okay. So I think conversations like this, being very forthright but very sensitive about, there's resiliency, of course, in survivors, but we wouldn't want anyone to feel that they have to remain silent because the value of someone else's reputation is more important than kind of their dignity and their safety. So thank you again. I just want to, for those who are viewing, if you'd like to get in touch with Nadiah Mohajir from Heart Women and Girls, her email is Nadiah, Nadiah, at heartwomenandgirls.org. All one word, heartwomenandgirls.org. Dr. Sarah Syed, she can be contacted at sarahsyed at khalilcenter.com. That's SARAH at khalilcenter.com. And you can also check out the website, and I'm sure they can also Google you guys as well. And Sarah Rashid, her email address is SRASHID3 at gmail.com. Again, that's Sarah Rashid at SRASHID3 at gmail.com. Again, I can't thank you guys enough for, lending yourselves for this hour and a half. I know you all have families and other things, but I really felt like it was necessary for especially for professionals to get an understanding of what our role is, as healers, as community members, and that message that it is important that people begin to have the conversation to break some of the silence, and to know that, as Nadiah, reiterates, that it has to be a victim-centric approach. So inshallah, this conversation will be uploaded immediately to YouTube. If you have any further questions or questions that you weren't able to have answered during this time, feel free to email Muslim Wellness Foundation at info@muslimwellness.com. And inshallah, we look forward to April's conversation around the Healers Collective. Just again, a forum for us to begin to speak about these issues from a clinical perspective and how it impacts our professional identity and practice, and a platform for us to begin to connect with one another. So we know that there's Dr. Syeds that are in Chicago. There's Nadiah who's there also doing great work, and also to hear from people that have lived experience, and that we can learn from as well. So inshallah, we'll be able to continue the conversation next month. And until then, assalamu alaikum to all of you.